The following is the recording for the occupational English test, and the test is held at Medcity International Academy, Kannur on the 1st of May in 2024. The candidate is Helen Satyapriya and the candidate number is 22485. The interlocutor is Shyam Panon and the interlocutor number is 18462. This will be role play number 1 for the profession of nursing. Good afternoon, Helen.
Good afternoon.
May I please see your identification?
Sure.
Thank you. Here you go.
Thank you.
This is a test of your English language and not in any way an assessment of your professional knowledge. Bear that in mind and speak as you would naturally in any given situation.
Sure.
I will take you through a warm-up session to get you started. This session is not in any way assessed. This is only so that you could get accustomed to this environment we have created. So Helen, my first question is, why did you choose to become a nurse?
Okay. I chose to become a nurse for numerous reasons. First, I could say that I'm naturally inclined to help people who are sick. And the second main reason is my role model is 𝐼𝐿TS, who is the founder of CNC Vellore. And she is a medical missionary from America. She enlightened the life of many South Indian women who are not having good access to medical services, which was denied due to their cultural background. You know, she enlightened their life so they could, gain more access to the medical services. So that inspired me more, where I thought nursing would, suit me as a good career than any other profession.
Okay, all right. What do you think are the recent developments or trends in your profession of nursing?
Currently, there are numerous trends in nursing, but I would like to speak on nursing education. Previously, we don't have this continuing nursing education, which we currently have now. Before, we used to, right after finishing our BSc or any UG course, we will go either into clinical side or into, lecturing side, and then we get stagnant with our knowledge. But now, due to continuing nursing education, we get updated with the current trends, and this is now mandatory to renew our license. So this really helps. And another thing that I would also mention here is the advanced courses, which is short term and also long term, which helps us to gain good standards in our career, which I should say as a career development programs. So that helps us as well. So that's about trends which I'm inspired.
Okay. So my final question would be, could you describe a patient of yours with whom you had quite a unique experience?
Sure. I was operation theatre nurse in Apollo Hospital, Chennai, during which I met a patient who has to undergo a surgery called as knee replacement, and before her surgery she was waiting in the waiting hall, lounge area, and I get to meet her before I could scrub in for the case. When I went to meet her, she was like not speaking much, but I knew that something is disturbing her. I just held her hand, and then when I started speaking, there was just tears rolling down her eyes, and she expressed that that's her first time for surgery, and then I introduced her the surgeon who's going to perform the surgery for her, and I told her I'm the one who's going to assist your surgery as well. And after meeting us, she was comfortable, and we made sure that she's in a safe hands, which helped her much. And what inspired me on this is, before leaving the hospital, she took an extra effort to come and meet me and thank me on the same, which really, was a unique experience dealing with a patient like that.
Yeah, sounds like a very good experience.
Thank you.
Okay, Helen, that concludes the time we have for the warm-up session. We will now move on to the actual role play. I'll be taking on the part of the patient or bystander or any similar role, and you'll be taking the role of the professional. The role play will last a total of 5 minutes, and you'll be given 3 minutes to prepare for the same. The role play intends to get evidence of your ability to perform effective communication with your patients. Do you have any questions now?
No.
Okay, so you'll have 3 minutes to prepare for this role play. Here is your card and a pencil. You can make notes on the card using the pencil if you wish to do so. And you can look at the card as many times as you want during the test. At the end of it, you will have to return it to me.
Sure.
Okay? So you can start preparing from now. Okay, Helen, that concludes the time granted for preparation. Now we will move on to the actual role play. Remember that you will have 5 minutes for this, and do not worry if I stop you in between. That just means that our time has concluded. We can start the session now.
Good morning.
Good morning.
I'm Helen, a registered nurse working in this clinic.
Okay.
You can call me Helen.
All right.
And can I have your name for the registration purpose?
Yeah, sure. My name is Jason Thomas, and I am 24 years old.
Okay. How do you prefer to be called?
You can call
Jason?
me just Jason. That will be fine, yes.
Okay. Jason, what brings you here today?
Well, I am in need for something that is called meningitis ACWI vaccination certificate. Now, this has arose because I am planning to travel overseas to study at a university for about a couple of months. So, before I book the slot for the vaccination, there are certain things I would like clarified because I have no idea about this vaccine. This is the first time that I've actually learned about this vaccine. So could you tell me more about it?
Sure. Thank you for sharing your concern with me, Jason. And I'm here to explain regarding the vaccine and why it is given. Is it okay with you?
Yes, please.
Okay. This meningococcal disease is a rare condition, but a serious condition. Rare in the sense that like 1 lakh, among 1 lakh, 20 will be affected. That rare it is.
Right.
And serious because it can cause, life-changing disabilities like amputation, hearing loss, brain damage, and at times even death. Okay. And the target group who are affected are teenagers, mainly young adults, with age group of 18 to 25.
Right.
So they are the main carriers of the disease who carry the disease and give to another person. Okay, so the next thing that I would like to tell you is there are some parts of the world which is considered as high risk parts. Okay, what if you're going to such places? So it's better that you get vaccinated and then go to your higher studies there. So that can prevent you to get contracted with the bacteria. So that's the reason we are advising you to go for this vaccine. I hope I made it clear for you.
Yeah, that is perfectly clear. But what I'd like to know more about is how is this vaccine administered and how effective is it against everything that you have just told me?
That's a commendable question, Jason. This vaccine is administered via deltoid muscle. The deltoid muscle is the muscle here in the upper arm. Okay, you will get a shot right here. Okay, it's a single dose vaccine. So you get a single shot, and then this vaccine is supposed to be taken 2 or 3 weeks prior to your travel. Okay, and you asked about the efficacy. Efficacy is nothing but the usefulness. Are you with me? Okay, this usefulness of the vaccine is said to be highly effective in the sense like it can help you to get prevented from 4 different types of meningococcal disease. That's why it is called as ACWY. There are 4 variants called as meningococcal bacteria A, C, W and Y.
Right,
So
right.
it gives a complete protection against all these 4 types. So that way it is highly effective. Okay, and the duration for effectiveness is 3 to 5 years. Okay, so once if you take this vaccine, you rarely get infected with meningococcal bacteria for next 3 to 5 years. I hope I made it clear.
Yeah, you have made things very clear to me, but I have read on the news and I have seen certain articles online about serious reactions to this particular vaccine in some people. So I'm not sure how safe it is.
Okay, that's a good question as well. You've read in the newspaper about the serious reactions for this vaccine.
Right.
Okay, but I'll tell you there are some side effects for the vaccine, but not exactly more serious reactions to it.
Right.
Okay, about the safety. I'll say that it is excellent. The safety record is excellent. Many people across the world has taken this vaccine for many reasons. Nowadays even children under the age of 3 are given a meningococcal vaccine, and then the adults and teenagers who are at high risk are also given a shot to prevent them from infection, contracting with infection. So it is highly safe and the record is too good. So you can just go for it. And I told you about the side effects, right? The side effects, initially you will have a redness or hardening at the injection site where you're getting a shot. Okay. Later you will have a slight rise in temperature and headache, nausea, and fatigue, which is called as generalized weakness. Right after taking any vaccine for the matter, you will have all these side effects, which will eventually go.
Okay, Helen, that concludes the time that we have for the role play.
Okay.
You can return the card to me now.
Sure.
Thank you.
Thank you.
Medcity International Academy. Trusted hands forever.